Hi, everyone. Welcome to This is Growing Old, the podcast all about the common human experience of aging. My name is Lindsay Clark, and I'm the Senior Vice President of Health Education and Advocacy at the Alliance for Aging Research. February is Heart Month, and on Wednesday, February 22nd, the Alliance will recognize Heart Valve Disease Awareness Day. We will be joined by more than 120 partners who are all working together to help raise awareness of valve disease. So what it is, who's at risk, what the symptoms are, how it's detected, and how it's treated. This year, we're working very closely with one of our Valve Disease Day partners, Heart Valve Voice Canada. We are excited to be expanding internationally and working with groups like Heart Valve Voice Canada. There are an estimated 11 million Americans with heart valve disease and more than 1 million Canadians, and growing. So this topic is of great importance to both of our organizations. Heart Valve Voice Canada has a number of really exciting events and outreach activities planned for Heart Month and Valve Disease Day, and their managing director, Ellen Ross, is here to tell us more about their work. Ellen has a wide variety of experience in marketing strategy and execution, health promotion, patient engagement, and corporate partnerships. Ellen has been with Heart Valve Voice since 2021, and before that, she worked with Heart and Stroke in Canada, Nestle Health Science, American Express, and other influential organizations. Ellen's also the chair of the Global Heart Hub's Heart Valve Disease Patient Council, and that council is represented by 16 patient organizations around the globe. And Global Heart Hub is an alliance of patient organizations working to provide a voice for those who are impacted by cardiovascular disease. Ellen also serves on the board of directors of Global Heart Hub. Ellen, thank you so much for your partnership.
So our core objectives are really to raise awareness around valve disease because we know that awareness levels are very low. A recent survey showed that less than 3% of Canadians over the age of 60 were aware of aortic stenosis, which is one of the most common forms of valve disease. We also are effectively campaigning for early detection, and that's why it's so wonderful to partner with you on this Listen to Your Heart campaign. We provide credible and independent advice to patients to support them across their entire patient journey, as well as being the voice for heart valve disease patients here in Canada.
That's all really incredible work, and I didn't realize about the awareness rates. That's really interesting. So we have a lot of work to do, but we have a lot of incredible plans, and I think we're making an impact. So thank you. And I know that last year, Heart Valve Voice Canada released a really important report called Heart Valve Disease Working Together to Create a Better Patient Journey. Would you give us an overview of the contents of that report and the goal of it?
Absolutely. Yes, we were really excited about this landmark report. It was developed under the guidance of a multidisciplinary advisory council who included people with lived experience, so the patient, as well as healthcare professionals that are engaged in heart valve disease in Canada. So from primary care practitioners, cardiologists, rehab specialists, clinical nurse coordinators. But what's really important about this report is that it's a patient-driven report, and the patient's perspective was the common thread throughout the report. It will be the foundation of all of our work in the years to come to ensure that we are getting heart valve disease patients the best possible care. What we know is that in international literature, there is an optimal patient journey that's been well documented. So what we did is we looked at what that optimal patient journey is for people with valve disease, what's happening in Canada, and where there are gaps. And we came up with 16 recommendations to address those gaps. So this report really provides clear guidance and a roadmap to decision makers and professional organizations on what should we need to do to reduce the burden of valve disease in the years to come. But we also hope this report serves as an empowering tool for people living with valve disease to encourage them to seek that optimal care for themselves and advocate for better care for others. So the good news is while heart valve disease is common and serious, we have effective and proven treatments, and we now have a clear roadmap to usher in a new era of focused and improved patient journey.
That's great. And can you tell people who are listening where they can find that report and where they can find Heart Valve Voice Canada?
Absolutely. The report is on our website. You can go to heartvalvevoice.ca and to the patient journey tab at the top and download a copy of the report as well as the key recommendations.
Fabulous. Well, and you mentioned it in talking about the Listen to Your Heart challenge and the importance of screening. One of the focuses of Valve Disease Day this year is screening for heart valve disease. And we know that it can be as simple as a stethoscope check. So I know that Heart Valve Voice Canada is hosting a screening event at Queen's Park, and there's other things going on. Will you tell listeners about the events and why you think that stethoscope check, that screening should be a priority?
Absolutely. So one of the key recommendations coming out of the report is that by 2025, all Canadians over the age of 60 or those with a family history of valve disease have a stethoscope check as part of their routine checkup. And that's really important because we know one of the big issues around valve disease is underdetection. And there's a number of reasons for that. One is the low awareness that we already spoke about. But also, we know that a number of people in advanced stages of valve disease are asymptomatic. So they don't have the symptoms that would flag them to go to their general practitioners and get screened. So that's why it's really important that a routine, regular stethoscope check is part of the routine checkup. Mall walks are very common here in Canada during the long winter months. And what happens is a lot of seniors will go to the malls early in the morning and get their physical exercise in those indoor shopping malls. So we will have those screening clinics start early in the morning to reach those seniors, as well as during the day when the general public are going. And we're super excited. This year, we're working with the West Edmonton Mall, which, Lindsay, I'm not sure if you're familiar with it, but it is one of the largest malls in North America and absolutely the largest mall here in Canada. And they are promoting Valve Disease Day for the entire heart month of February. And on February 22nd, they will be having 4 cardiologists at the mall doing stethoscope screening and educating the public on Valve Disease Day. And they have over 25,000 people that come to the mall every day. So we are expecting a tremendous turnout. Mm-hmm. So very excited and happy to partner with them.
Yeah, I mean, it's just amazing what you guys are doing. I know it will have a huge impact. And I wanted to flag for listeners that this Listen to Your Heart challenge, anyone can participate in. So if you can't make it to a screening event, if you're not going to be at West Edmonton Mall, or if you're not in Canada, one thing you can do is make an appointment to go get your heart listened to. And Ellen, you touched on this, but make an appointment. If you can go between now and the 22nd, fabulous. If you can't get there between now and the 22nd, make sure you make that appointment and then share on social media. Share a picture on the way to the doctor. Share a picture getting your heart listened to. Maybe it's a picture of your calendar, but show the people who follow you how important it is to listen to your heart and how easy it is, frankly. And I think we can really spread awareness that way. So there's a way for everyone to participate, even though those events sound amazing, and I'd like to be at all of them. So now we're going to turn to more lighthearted questions that we ask of everyone who comes on the podcast. And the first is, when you were a kid, what did you imagine that growing older would be like?
Well, that's a really good question, Lindsay. And I think when you're younger, you don't actually think about growing older because it just doesn't feel like it will ever happen. But we know it does. But looking back, I think I was fortunate to have all 4 of my grandparents live into their late 80s. And for the most part, they had good health. And they were very actively involved in their community and spent a lot of great quality time with family and friends and traveled. So I guess that's sort of what was represented to me as my mature age, what that would look like. So I hope that does play out.
Yeah. And now, so we're all aging. What do you enjoy most about aging and growing older now?
Another great question. And it's funny because I often don't think of myself as growing older, and it's not till I'm relaying a story and I say that happened. And when I reflect back, I go, no, that wasn't 10 years ago. That was 30 years ago. And then I say, wow, I am growing older. but I think it sounds cliche, but I think it's true. I think it's the wisdom that comes with age and experience. So I think the lived experience that we've had over the years plays into both professional and personal decision making, and it's easier to make decisions with the wisdom of lived experience. But I also think, you know, my mother always used to say the days are long, but the years are fast. And as I am aging, that proves to be really true. So I really try to enjoy every moment and opportunity that comes my way, because the years are fast.
Oh, for sure. They fly. And that's a really important perspective. I wish we could have that wisdom when we were like 15, but we'll take it now, right?
Absolutely.
Well, that's all for today's podcast. Ellen, we're so grateful for everything you're doing to raise awareness about heart valve disease and for taking the time to come on today and share a little bit about your work. Thank you so much for joining us.
Well, thanks for having me. And I look forward to all the events on February 22nd and getting that really important message out.
Oh, we do too. And everyone should go online, go to Heart Valve Voice Canada, go to Valve Disease Day, check us out on social media. There's a lot going on. There's a lot of ways to participate. And to everyone listening, thank you for listening to This is Growing Old. If you're enjoying the show, you can subscribe wherever you get your podcasts. Have a fabulous day and happy Heart Valve Disease Awareness Day.